Hey guys, welcome back to theclinicaltrialsguru.com. Again, it's theclinicaltrialsguru.com. So if you don't know how this works, first of all, if you're new, make sure you subscribe. Subscribe on YouTube, subscribe on the blog. You don't want to miss out giveaways and things like that I do from time to time. But if you are new here, here's how this works. Usually, you ask questions and I'll answer it. Although sometimes I'll create topics that I think are important to talk about. But today, I'm answering an email from someone, an email question, and it's Dan at theclinicaltrialsguru.com. It says, "Hi Dan, is it possible to become a CRA with no experience and without a science degree? My degree is in business administration. I have over 7 years experience as an inventory auditor and field service professional, and I'm also a licensed realtor with over 10 years of contract experience. I want to branch out, and I know I can do the job, but need to know how to get started if it's even possible. What should I do?" So, first of all, I love hearing from my fellow realtors, and especially my fellow realtors who are interested in the clinical research industry, or vice versa. A lot of clinical research people are interested in the real estate industry as well. I want to say that nothing is impossible. But I do think that CROs, who are the ones that are going to end up hiring you as a CRA, they do want to see some experience. So it's not necessarily the science background that may prevent you or may make it difficult for you to find the job. It may be the lack of clinical research experience. And I know you have QA experience in different industries, but clinical research is so unique that it's often very helpful if you do have even just 1 year of experience. And I don't know what your situation will allow for, but if you can intern even part-time or maybe work part-time as a study coordinator at a research clinic, because that's usually the stepping stone into becoming a CRA, is to be a study coordinator at a research clinic. It's often a lot easier to get hired at a research clinic with no experience than it is to get hired at a CRO with no experience. Although it is, it might be possible, so it might be worth trying. What you might want to do is actually try to apply to some CROs. I don't know if you've tried yet. And the worst they can do is say no, and you're missing some experience. And then you can kind of hopefully establish like a back and forth dialogue between you and whoever it was that's making that decision, and asking them, hey, would it help if I interned at a research site or even worked part-time at a research site for 1 or 2 years and then reapplied? You might actually get some good feedback from them. And also you should do some of the training, like GCP training. There's free online training for GCP. There's a CITI training. Some you have to pay for, but you can find a lot of free trainings for specific to clinical research online. So if you have those certificates and that training, that can also strengthen your case to get hired. So try that. Try getting the certificates online and apply that way. That way it's not like you don't have any experience. You have some certificates at least. And if you're not getting the job, go apply at a research site or even intern if you have to get that necessary experience, and combined with those certificates that you have, and then go out, reapply to all the CROs to get that job. And again, it's not your lack of your science degree, it's your lack of experience that's going to be your biggest obstacle in this case. But there are ways around it. So hopefully this helps you. Let me know if you try it out, and let me know what comes out of it, okay? Dan at theclinicaltrialsguru.com, and good luck.